A new layer revealed as we attempt to understand and defeat the coronavirus.
That's right, Sean. Researchers from cities with predominantly African American populations show how the virus impacts that community.
Disturbingly, this information is going to show you that slightly more than 70% of all the deaths in Louisiana are of African Americans. Slightly more than 70%. And so that deserves more attention, and we're going to have to dig into that and see what we can do to slow that trend down.
Monday, Louisiana's Governor John Bel Edwards began to scratch the surface on an underlying issue: coronavirus cases and deaths among African Americans. CBS 46's Haley Mason is live in Atlanta breaking down Georgia's collected racial data concerning the coronavirus. What do the numbers show, Haley?
Hey there, Rick. All across the country, state health departments are starting to see that the coronavirus is impacting Black communities at strikingly high rates. I've been digging through those numbers across different states and just got a closer look at the cases in Georgia. From the devastating death toll in Albany to cases throughout Metro Atlanta, new numbers show that the coronavirus is hitting Black communities the hardest.
Right now, in the absence of demographic data, I just sort of see it sort of a blind approach to dealing with the crisis in our community.
The problem, there is very limited data in Georgia, unlike other states. For example, in Milwaukee County, Wisconsin, Black patients make up nearly half of the 945 cases and 81% of deaths. The county's only 26% Black. In Michigan, Black patients make up 35% of cases and 40% of the deaths. Detroit is the hotbed. In Louisiana, 40% of deaths happened in Orleans Parish, which is mostly Black. John Eves is a former Fulton County commissioner and former chair of the Public Health Committee. He's been holding weekly virtual town hall meetings, calling on state health officials to collect and release data on how the novel coronavirus is impacting minorities.
It's inexcusable and it's borderline irresponsible for that data to not be collected on the local level so that decisions should be made.
I reached out to the state health department, which sent me this data. It shows that Black patients lead in coronavirus cases and deaths in Georgia. White patients have more than 1,200 confirmed cases and 88 deaths, while Black patients have more than 1,300 confirmed cases and 104 deaths. The striking number is the unknown category. More than 5,400 patients do not have a listed race. More than 108 of those who died have an unknown race listed.
There are more unknowns than there are knowns, and that is, we need to do a better job of recording.
The state tells me that some patients are listed as an unknown race because race information just was not filled out on the electronic form.
Every single part of it, including ethnicity and race, is important, along with past medical histories, family history, medications, and allergies. It's important to be inclusive of all of that. We need to know the breakdown of the numbers. It's important for us and how we give care to our patients.
And it is a double-edged sword for many Black communities where pre-existing conditions exist, and also there are challenges with health care access. Right now, the state is faced with the mammoth task of going back through those records and trying to fill in the race and ethnicity that are currently listed as unknown. I reached out to the CDC about this data. They tell me they are still compiling it and hoping to release it this week. Reporting live in downtown Atlanta, Haley Mason, CBS 46 News.